Back with me today is Dr. Brett Frykberg, orthopedic surgeon at the Jacksonville Orthopedic Institute. Doctor, thanks for being here.
Thanks again for having me.
I know when we spoke with you last time, we were talking about how active you were in competing on the track team at the University of Tennessee and part of SEC championships, national championships. Are you still active today?
I try to be as much as time allows, but I really enjoy running. It helps me relax, it helps me keep my heart rate up and exercise and keep the weight down, and it helps me relate to my patients.
When you say running, marathons, half marathons, or just going out running a couple of miles?
All of the above. I joined a couple of running groups in town, and they've got me into running as far distance as a marathon, but I ran New York City Marathon, I've run the Donna Hicken half marathons and the series that we have here in Jacksonville.
Do you run every day?
No, 3 times a week.
3 times a week, and you can stay in shape enough to go out and run. I guess you're training if you're running a marathon.
Absolutely, yeah. So staying in shape, you don't need to do more than 3 times a week, but when you're gearing up for a big race like that, river run, marathon, anything of significant distance, you got to have a training program, probably going to do a lot more than 3 times a week.
Do you do anything else on the other days you're not running?
Exercise-wise, not really, because I work a whole lot, but eating right, watching what my body takes in, making sure that I'm still getting some kind of exercise during work, whether it be standing for a long period of time rather than sitting, little things.
Any advice you would give, and I always like to ask, trainers, doctors, that you will give an athlete or a weekend warrior to maybe help prevent something, or how best, in terms of diet or stretching, or what someone can do to help keep themselves active longer?
Take care of your joints, and to do so, all of the above come into play. Diet is a huge deal, because when we can't exercise as much, diet is the only thing that prevents us from gaining weight. So after the diet, exercise, low impact exercises. Running is probably not the best thing as we get older, especially if we're heavier, but swimming, cycling. I mean, we live in Florida. It's so easy to go out and ride a bike in the middle of January or February. Elliptical machines, anything that gives you good motion of the joint without the high impact of running and slamming your knees down across the pavement. But losing weight is an incredible loss to your knees. Every time we walk, it's about 6 times our body weight go through our knees.
6 times our body weight.
Right. So if you think about it, if you lose 5 pounds, that's really 30 pounds off each step of our knees. And if you're going upstairs, it can be as high as 10 times our body weight. So
I guess that's mind-boggling when you think about if someone is unfortunately overweight. That's a lot of force coming down.
It is, and to put it in little things, you can't. It's hard to tell somebody to say, hey, go out and lose 40 pounds, you'll feel better. But if you break it down and say, try losing 5 pounds and try it over a period of like a month, and slowly that weight will start to come off, and they'll really feel the effects of it soon.
Any point in life, you probably need to start trying to do this. You're never too young, never too old.
Correct. It's better at it. You just have to make the decision to do it. Say, I want to feel better. I want my joints to feel better. I don't want to have surgery. I want my life back. Those type of questions, when it comes to you, you have to answer them, and the way to do it is to start.
Well, thanks for being here today. The advice you would give would be to take care of yourself, diet, keep your weight in check. Of course, if you do have an issue, make sure to get out to the Jacksonville Orthopedic Institute, talk to Dr. Frykberg, and we'll get you back in and talk about some specific joint problems, joint replacement. Thanks for being here.
Thank you very much.